Hi, let's talk about renal pathologies and developmental abnormalities. So for this station, I hoped to give you a couple of examples of kidneys that are either affected by pathological or disease processes or by processes of developmental abnormality. And so for the first example I have for you is a kidney which is affected by polycystic kidney disease, or PKD. Polycystic kidney disease is a group of genetic disorders that can lead to a kidney being covered or imbued with many fluid-filled cysts. So it's not all that unusual to see perhaps one or two fluid cysts in an adult kidney, but with a polycystic kidney, we can see that there are many of these cysts. They're numerous, and they can even affect the structure, the size, the shape of a kidney. And not only can they affect renal physiology, but they can also put strain on the cardiovascular system as well. And it's not uncommon for there to be elevated blood pressure or hypertension in association with those with polycystic kidney disease. Now, the two major forms of PKD are either autosomal dominant or autosomal recessive. The dominant is the more frequent form, with an incidence of about 1 in every 500 to 1,000 births, whereas the recessive form has an incidence of about 1 in every 20,000 to 40,000 births. The next abnormality is a fusion abnormality, and this happens when the inferior poles of the kidneys fuse along the midline. Now, the kidneys ascend out of the pelvis and to their location with their hyla approximately at the L1 vertebrae during development. But with a horseshoe kidney or renal fusion, what happens is these kidneys get hung up on the IMA, or the inferior mesenteric artery, and never fully move to the L1 position. Now, they still have their own renal vasculature, they still have their own urethra, but they are fused, and so they're out of position. This has an incidence of about 1 in 500, or 0.2% among live births. And then finally, I have an example for you of renal ectopia, or an ectopic kidney. This is when a kidney is found in a location other than where they may typically be found. And this one is an example of a pelvic kidney. And so we can see there is the psoas major muscle there and there. Here's the common iliac arteries to the external iliacs and the internal iliacs there and there. And this particular kidney has connection to this right common iliac artery. Ectopic kidneys are generally, developmental abnormalities that aren't detected unless they are problematic. It's thought that they might have an incidence of about 1 in 1,000 live births, but again, the full evidence there is somewhat lacking. What's interesting about this particular renal ectopia is that this is the location where renal transplants generally reside. So to find good connections amongst vasculature in areas is very difficult, and accessing the retroperitoneum is also a difficult surgery. And so more often than not, when a person receives a kidney transplant, there is strong vasculature with good access in the pelvis here. And so surgeons can connect the renal vasculature to common iliac arteries or veins, and so this is a fairly common place for a renal transplant. Thank you very much for your time.